company.
Oh.
But that's that implant. Now, the reason we were lucky is your body was making this scar tissue, which was around it.
Wow.
Walling it off like a oyster walls off a grain of sand.
Wow.
So see, this thing was just holding in, and that's why it felt all hard, because obviously that's not hard, but inside of this tight thing, it was hard. So, you know, people think, oh, that's tough, it must keep the silicone in, but you can see there's a lot of blood vessels in the surface of that, so your blood is constantly being bathed in the little micro droplets. Now this thing was stuck down on the back to your ribs. Had to peel it off. This actually little white stuff is the covering of the ribs.
Wow.
And it was starting to eat a bit into the muscles. So actually when I got done, your muscles were so thin I could almost see your lungs move. I could see your lungs moving through it.
So what'll happen with that?
Oh, it'll heal.
The body will rejuvenate.
Yeah, the body will rejuvenate it. But it just says to me, you know, that stuff's really close to the lungs.
Right.
And then this is the skin that we took off to tighten, okay? Now this was your good side.
That was the good side.
So let's look at the bad side. And we'll put this up, get new gloves.
That was the good side.
That was your good side, right? Sorry, it burns my eyes. So
Oh
that's
yeah,
why
you can feel it.
yeah, I can feel it.
Mm-hmm.
So this side, you can see that silicone is even more liquid. It's just like soup.
Oh yeah, gooey.
Gooey.
Mess.
Big mess.
Mm-hmm.
So it had been ruptured longer. You can see it's more cloudy. It had mixed in, I think, with proteins and stuff. This scar tissue was a little bit thicker, thankfully. And it had some calcium in it. You can see this white stuff. Listen to how it crunches.
Wow.
It's like eggshells.
Wow.
But again, our bodies are smart. They're trying to wall it off. It's like a oyster in a grain of sand. Okay.
Amazing.
But again, it's not super thick, so you can see through it in some places. And I'm just glad you never bumped and it popped and then stuff would have gone all out into your chest. It was trying real hard to keep it in. The reason you're sore is because I had to dig a little muscle here. You can see this little brown reddish stuff is muscle, so that's probably why you're a little bit more sore in that area, because that was up
On the right side?
yeah. And again, a little bit of skin that we took off.
Wow. Look at it sticking.
Yep. We try not to get this on the floor, because if I do, then we have to strip the floor. It just doesn't come up with normal cleaners.
No.
Very sticky stuff. I don't think it's good in your body at all.
No.
But nothing that looked like cancer. Okay.
Oh, good.
When I was, you know, I felt through your tissues. Your tissues are real thin, so I could feel everything, and everything seemed good. And let's see. Oh, I left your chart up at the front. I wrote down the weights and things. The scar tissue.
Yeah, so now I weigh 90.
Average and
yeah, right.
so anyway, that's out of you now, and hopefully you're gonna start feeling better. Like I said, I remember I had at least one other patient like you with that chronic cough. Boy, she had the mega workup. Nobody could find out what it was, and once we got that stuff out, her cough went away.
Oh, you know what? They wanted to remove part of my lung.
Woohoo!
Yeah.